do tonight.
Miriam Cates.
Thank you, Madam Deputy Speaker, and it's an honour to follow the honourable member for Wellingborough. I'm in absolutely no doubt that we do need to raise the money to enable the NHS to recover from the pandemic. And it would be wrong to raise this money through more borrowing. We shouldn't expect our children and our grandchildren to settle the debt sometime in the future. We need a plan to pay for it now. So the criticisms of this motion come not so much from the fact that the government is choosing to raise the money, but more from the way it is being raised. And the criticisms centre around one central concept, the idea of fairness. And I think, as we've heard in this debate, fairness is extremely important for Conservatives. And if government is to be the force for good that it should be, we need to make sure that our policies are as fair as possible, that benefits and costs fall in a fair and equitable way across our population. And I accept that there is some unfairness around using national insurance to raise the levy. But in order to raise the cash required, we must use a broad-based tax. A VAT rise would have a disproportionate impact on those on low incomes. And using income tax would not incur a contribution from businesses. And of course, businesses very much benefit from health and social care. Huge numbers of people would have to leave the workforce if those services didn't exist. So on reflection, I do think that using national insurance to raise this levy is a fair way to proceed, especially given that my right honourable friend the Chancellor has made sure that dividends and working people of pensionable age are also included. So I support the motion today because I think we have to acknowledge that politics isn't about striving for perfect solutions. It's about finding the best solutions possible within the financial, practical and moral constraints that bind us all. However, whilst the money raised through this motion will be a start, it won't be enough. We have to accept that health and care costs are many times higher now than they once were. And I want to echo the comments of my honourable friends, the member for Wickham and Milton Keynes on this. When the welfare state was born, life expectancy was around 65. Many people left school in their early teens and entered the workplace. In the 1940s, an individual might spend well fewer than 20 years of their lives not working. Now, people can spend more than 40 years of their life not working. So simply put, during our working lives, we must now pay a lot more, double, perhaps more, taxation, pension contributions and insurance to fund our decades of economic inactivity. We can't escape that fact. So raising any additional money in future, we must be far-sighted, inventive, creative, look to other countries, as other honourable members have said. So in addition to taxation, we could look to build on the success of our automatic enrolment model for workplace pensions, consider some form of contributory insurance scheme. But we must also be clear that there are alternatives to ever-increasing bills for health and social care. And so I hope to see extensive consideration of local, community and capability approaches in the White Paper. And we mustn't forget the crucial role of the family. How can we help families to look after their own relatives well for longer and with appropriate support? So I acknowledge and understand that there are criticisms of this motion, but doing nothing is not an option. And when it comes to finding a pragmatic solution to such a difficult and urgent issue, I am convinced that this is a fair approach for now.
Richard Drax.